Stoke-on-Trent City Council commissioned the research because they really wanted to understand what is happening locally around drugs that are referred to as monkey dust. So they specified that they would like to hear from the views of professionals and also, really importantly, people with lived experience of taking drugs referred to as monkey dust.
A significant key finding is that monkey dust drug usage tends to be part of someone's wider usage of drugs, and also there's a smaller percentage of drug users across the city who are using monkey dust than wider substances. We recognise that communities might feel distressed over people using monkey dust in their communities, and there can be an assumption that it's monkey dust when in actual fact it's other things going on for the individual, and in many circumstances there's not confirmation that the person actually took monkey dust.
So for me, I think a key part of it was that there's a lot we don't know about monkey dust use still, and the drugs that are referred to as monkey dust, because it's not a clear picture that you can say this is what it is, this is what is within it and the ingredients within it, and this is how it will make people behave, or this is what it will contribute to behaviour wise. Not everybody responds or reacts or behaves in the way that is often portrayed in the media. So it's about trying to understand, well, what is that difference there? Is it about the different type of monkey dust, the different ingredients within it? Because we heard about sort of white, yellow, grey, orange, brown, different types of it. Or is it how it interacts with other medications that a person could be taking on that leads then sort of counteracts and leads to a different outcome for them.
So it's really important to have some forensic testing, and here at Staffordshire University, in partnership with Staffordshire Police, we're beginning to test forensic samples of monkey dust so that we know what's in the substance and the levels of purity, and also the kind of impacts therefore it will be having on individuals.
We're really pleased to be working on partners to take some of the recommendations forwards and to try and build and develop this evidence base. Funding and the resource attached to the new drug strategy, Stoke-on-Trent have received a lot more resource and funding attached to that, so it's meant that we can sort of put into action some of the things in the report and the recommendations in a way that might not have been as achievable previously. So we're really pleased to be part of those ongoing conversations around taking the research forward.
It's important as a city that we work on destigmatising people who are using drugs, including monkey dust, in order to understand the reasons that why people are using the substances. And it's also really important that we have better treatment around the adverse childhood experiences and the trauma, and around mental health and well-being too. And we're really privileged at the moment to be working alongside partners, including the City Council, on action plans to increase this kind of support for people. And at the moment, if people want to access support, you can do so through the Stoke-on-Trent Community Drugs and Alcohol Services, and there's been additional resources put into these services to support people who are using monkey dust.